Hello, my name is Peter Lawrence, and I'm pleased to introduce the July issue of the Journal of Vascular Surgery, and to highlight 5 outstanding papers which are freely available for the next 2 months. The CME and Editor's Choice article for this issue is 5-Year Survival Following Endovascular Repair of Ruptured Abdominal Aortic Aneurysms is Improving, by Fiveyear and co-authors using the VQI multi-institutional database. They did a retrospective review of patients who had a ruptured abdominal aortic aneurysm repaired with an endo or EVR procedure from an early period, that is 2004 to 2012, versus a later period, that is 2013 to 2018. The EVAR data for propensity-matched patients, in other words, similar patients, was compared in a similar time period with patients who had an open ruptured abdominal aortic aneurysm repair. The 5-year survival for EVAR improved from 49 to 63% between these 2 time periods, while it worsened slightly for open repair from 59 to 52%. Although this was not statistically significant. This study shows why there's an increasing trend toward EVAR for all ruptured abdominal aortic aneurysms, even transferring patients to hospitals who have the facilities and skill set to do EVAR for a ruptured aneurysm. Our next highlighted article, titled Midterm Outcomes from Brachial Arterial Prosthetic Loop for Permanent Hemodialysis Access, is by Ali and co-authors from Egypt. In patients with exhausted upper extremity veins, they performed 89 brachial arterial prosthetic loop hemodialysis access grafts. The primary patency was 62%, and the secondary patency was 90% at 2 years. Complications included pseudoaneurysms, hematomas, and infection, but these are also common complications in arteriovenous upper extremity prosthetic grafts used for hemodialysis. The authors advocate an arterial procedure as a durable bailout for patients without patent upper extremity superficial veins. The third article by Chin and co-authors is entitled Implications of Early Failure of Isolated Endovascular Tibial Interventions. Since there is a debate about the impact of an endo-first approach for chronic limb ischemia on limb salvage and subsequent procedures, the authors retrospectively evaluated 1,779 patients from a single center who had an endovascular tibial procedure for chronic limb-threatening ischemia. There were 16% of the patients who had an early failure, which they defined as less than 30 days. And when this occurred, there was a significantly lower amputation-free survival of 16% versus 47% in those who did not have failure. Diabetes and renal failure were independent predictors of failure, as well as anatomic factors. In addition, the long-term clinical efficacy was significantly worse in those who had early failure, with only 11% having limb salvage versus 39% who did not have an early failure. When failure occurred, it was both hemodynamic and progression of the chronic limb ischemia. The authors concluded that early failure of tibial interventions for chronic limb-threatening ischemia is a significant predictor for poor early and late outcome and limb salvage. The fourth article is Similar 5-Year Outcomes Between Female and Male Patients Undergoing Elective Abdominal Aortic Aneurysm Repair with the Ovation Stent Graft, by Fiveyear and colleagues, who examined the gender difference in outcome related to the use of the Ovation endograft for repair of aneurysms. They did a meta-analysis of approximately 1,300 patients from several different series who were reported to have undergone the Ovation endograft treatment of an abdominal aortic aneurysm, with 19% being women. Women were older and had smaller aneurysms and smaller neck diameters. But these, when adjusted for body surface area, were actually larger aneurysms. The anatomy of the aneurysms in women showed shorter proximal necks, smaller iliac arteries, more angulated necks, and more reverse tapered necks. In spite of many differences, the 5-year freedom from endoleak and freedom from intervention was similar, with both at greater than 90%. In addition, all-cause survival at 5 years was similar between men and women at approximately 80%. These data show that in spite of the many differences in anatomy and size, the outcomes between men and women are similar. The final article highlighted this month is Society for Vascular Surgery Clinical Practice Guidelines on the Management of Visceral Aneurysms by Sher, Abularaj, and co-authors. They provide guidance for treatment of visceral aneurysms, which include renal artery aneurysms and branches of the celiac and superior mesenteric arteries. Each aneurysm has unique aneurysm size and morphology characteristics, as well as additional indications for repair, such as pregnancy and hypertension. In addition, the document identifies unique morphology, such as pseudoaneurysms and saccular aneurysms, as well as growth rates, which might suggest the need for earlier repair. This document will become the gold standard for visceral aneurysm management, although it will need to be continually updated as additional studies are conducted, since some of the recommendations are based on small retrospective studies and therefore are currently level 2 evidence. Thank you for watching. For more information, please follow us on social media and remember to like, comment, and share. We hope you enjoy these 5 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery. Remember that these articles are free to read until the end of August. And thank you for your attention. And in this COVID era, please stay safe, and we hope that you have good health. Thank you.